Everyone, and welcome to today's MinMD Real Talk webinar, Vacuum Erection Device Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at MinMD, and we're excited that you are joining us today. Before we get started, we have a short disclaimer that we need to review.
The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right, with that being noted, I'm pleased to introduce today's presenter, Dr. Jeffrey Loh-Doyle. Dr. Loh-Doyle is a board-certified urologist who specializes in complex surgical reconstruction of the male urinary tract, male urinary incontinence, erectile dysfunction, sexual health, urethral, stricture disease, and Peyronie's disease, and is located in Los Angeles, California. Today he's going to cover VED device assembly, penile reconditioning, VED use for sexual activity, penile rehabilitation for post-prostate treatment, and then hold a live Q&A to close out the webinar. But before then, so without any further ado, I'd like to kick things off by welcoming our presenter, Dr. Loh-Doyle. Over to you.
Thanks, Austin, and I really appreciate you guys for having me on board. And I also want to thank all the attendees here as well. So it takes a lot of courage and a lot of motivation to kind of take these first steps to educate yourselves and to really be on top of getting control of your quality of life and really making sure that you can have a very good sexual function and an erectile function moving forward, no matter how old you are. So, as Austin said, I'm a faculty member here at the University of Southern California in Los Angeles. I'm fellowship trained in genitourinary reconstruction as well as prosthetic surgery. So what does that mean is basically I'm a quality of life guy. I take care of patients oftentimes that have been suffering from prostate cancer, bladder cancer, and they've been treated with a major operation, and now they're suffering some after effects like erectile dysfunction or urinary incontinence. So I'm very well versed in taking care of any patient that has these issues. So a little bit about the erection process. So, if you guys have done any basic reading, you can just kind of know that an erection is completely dependent on blood flow. It's all about blood supply. So the erection process is like a very sophisticated bathtub. All it is that you need to have enough blood flowing into your penis with arteries. And once there's enough arterial blood in the penis, what happens is that it starts to clamp off the veins, which typically would allow blood to drain out of the penis. And so if you have enough pressure in the penis, it clamps off the veins and it allows the penis to stay rigid. So that is really all it is. You need to have enough blood flowing in, and you can't have blood escaping. And so that would give you a good erection. Well, a lot of things can kind of happen which affects both inflow of blood as well as outflow of blood. And that's where, we have to do treatments to address those issues. So we're here today to discuss specifically the vacuum erection device. And, our national guidelines, which is released by the American Urologic Association, give a whole list of tools that us as urologists have to treat erectile dysfunction. And one of the main tools is a vacuum erection device. It stood the test of time. It's been around since the 80s, and it's FDA approved for the treatment of erectile dysfunction, no matter how moderate or severe it is. So all it is, it's a vacuum, as the name implies. So it's a hollow plastic tube which you place over the penis. It can either be manual or battery operated, and with the pump, it creates a vacuum that pulls blood into the penis. For patients that want to use this for sexual activity, you also use a constrictive band at the base of the penis, and that just keeps the blood in the penis, very simply. Also, what we're now using a vacuum erection device more and more is for the concept of penile reconditioning, meaning that, all right, well, you can maybe still have an erection, or maybe you can't have an erection. But as you guys know, it's all about blood flow, and you need to have good blood supply to any part of our body in order for it to maintain its health. Well, in patients that are recovering from surgery or they haven't had an erection for a long time, you need to recondition the penis to be used to having blood flow. You don't want to make those tissues healthy again. So when used properly, a VD will produce an erection in over 90% of men. So it's very effective. And arguably, it's more effective than most other treatment options that you guys are familiar with. So the vacuum erection device has a learning curve. There's no doubt about it. And so just like any other medical device, and if you folks have had any type of orthopedic surgery, you know that most of these orthopedic braces, splints don't come perfectly fitted right out of the box. You have to do some little nips and tucks, you got to adjust it, and you got to do things properly so that it works for you specifically. So VEDs are made up of components, and they can be changed depending on your size and your goals. So we'll just review the important things that I like to discuss with my patients about before even using a VED. First off, I tell patients you will be frustrated when you first start using it. But if I create this expectation that there is a learning curve, that you're not supposed to be a master right out of the box, then I think that patients are very accepting of that learning curve. You know, things that do help with a vacuum erection device is obviously having a willing partner. So there's lots of guys out here that don't have a partner. That's totally fine. So it's up to you. I mean, if you are motivated to get something that works with an over 90% efficacy, I think that, you know, that right there is motivation just to kind of take the time to really work this thing properly. There's plenty of resources available, including with MinMD. They're outstanding at actually giving patient-specific instructions. And you have to commit to this. Again, it's going to take practice. Practice makes perfect. And if you're unhappy, keep practicing. And so if you're at any point where you feel like you've just reached a plateau, there's lots of resources. Again, contact MinMD, and they're very good at putting you in touch with people that can kind of work with you on how to make this better for you. So we'll first talk about the vacuum erection device for penile rehab or penile reconditioning. So again, it's not necessarily using the vacuum device to achieve an erection that is good for having sex. It's actually just bringing blood into the penis when the blood has been, in essence, been starved from the penile tissue. So how this works, so I think that this is very, very important in patients, in particular, that are recovering from a prostatectomy, or they had radiation for prostate cancer, or even if they've had bad diabetes, or you just had bad luck and your erections just aren't that great. So you want to nurse the penis again. You want to give it good blood supply. You want to give it oxygen. And so the reason and the rationale behind that is that all us men, when we were younger, we had morning wood. You know, we had those nighttime erections, and you're like, man, I'm waking up with a really stiff erection. Why is this happening? Well, that's actually our body's natural way of nourishing our penile tissue. So what this penile reconditioning concept using a vacuum device is, we're going to be doing the same thing. We're really conditioning the penis. We're making it healthier by bringing blood flow into it. So how does it work? Well, you use the vacuum device 3 to 5 times a week for approximately 20 to 30 minutes each time without a tension ring. So in most cases, you can do this for 1 to 2 weeks, and that can be enough time to recondition penile tissue. Now, the more you do it, the better. So 2 weeks is the minimum. You know, I have some patients that are, you know, are about to get an inflatable penile prosthesis. They're concerned about penile length, and I will introduce the concept of using a vacuum erection device for penile reconditioning. So not for sex, but just to really bring the elasticity and stretch back to the tissue. So we'll just briefly review the components of a vacuum erection device. Number 1, there's a pump head. Number 2, there's a tension system or a loading cone. 3, there's a cylinder. 4, there's inserts. 5, there's a tension system. And 6, most importantly, there's lubricant, so it's comfortable. So you first want to assemble the vacuum device. So the first thing is, you want to line up the negative pressure pump head device with the cylinder. You place the black inserts in the open of the cylinder, and then you turn the pump head clockwise 1/4 inch to secure it to the cylinder. So now you've got the chamber that's now attached to the pump. Now you need to prepare the vacuum device for your penis. So you need to generously lubricate the open end of the cylinder so that when you place the penis, it doesn't get stuck to the actual ring. So you want to spread a generous amount of lube around 2 inches deep in the inner portion of the cylinder. So most importantly, you want to lubricate the head of your penis. If you don't use enough, the head of your penis will stick to the cylinder. Not comfortable, it's going to hurt. So again, lube is your friend, keep doing it. And so now that you've placed the penis into the opening of the cylinder, you hold the cylinder gently against your body, and it's important to tilt the cylinder down approximately at a 45-degree angle. You then start using the battery or start using the manual pump, and you pump the handle 3 times, or you press the square black button for 5 seconds, you wait 10 seconds, and then that actually will bring blood flow into the penis. And you repeat this process until the penis is fully erect. So you're just gently inching your penis out with more blood. So when you're done, after about 15 minutes, you release the erection by pushing the round black button on the pump head. There's no science behind the actual time. The more you do it, the better. I wouldn't leave it on there for too long because it becomes a little bit more uncomfortable. Most of my patients do about 15 minutes. So after the erection is created, hold the erection in the cylinder for 1 to 3 minutes. You release the erection in the cylinder while maintaining the seal between the body and the device. And again, you repeat this process 3 to 5 times for, again, a total of 15 minutes, which is what I recommend. So now we're going to be playing a video of how to use a vacuum erection device for sexual intercourse. So let's just switch to that.
To best understand how to use the system, it's helpful to see an actual demonstration.
Step 1. Loading the tension system. Place the loading cone into the bottom of the cylinder and place it on a flat surface such as a table or countertop. Lubricate the loading cone. Grasp the bulky part of the handles of the tension system and slide it down onto the cylinder, mounting it approximately a 1/4 inch from the edge of the cylinder. Remove the loading cone. Insert the large comfort insert into the base of the cylinder. If necessary, insert the small comfort insert into the large comfort insert. Step 2. Assemble your system. Assemble your system by lining up the negative pressure device with the negative pressure cylinder. Give the negative pressure device a 1/4 inch turn to secure to the negative pressure cylinder. Do not over tighten. Step 3. The lubrication process. Lubricate the inside of the bottom of the cylinder generously up to 2 inches inside the cylinder. Lubricate the glands of the penis to ensure that during engorgement the penis will not stick to the sides of the cylinder. As if applying toothpaste, lubricate the rim of the cylinder and comfort insert with a generous bead of lubricant. Step 4. The application process. Apply the system over the penis with the system pointed down towards the floor at a 45-degree angle. Make sure that the penis is resting at the bottom of the cylinder. Give the system a twist back and forth to ensure that a good seal is created against the body. Do not press the cylinder too hard against the body. Begin operating the negative pressure device by pumping the handle 3 times. Wait 10 seconds to allow blood to flow into the penis. Continue this start and stop process until the penis has reached full engorgement and the penis has lifted from the bottom of the cylinder. Be careful not to create negative pressure too quickly or over pump. Step 5. Tension system transfer. Holding your hand as if making a C, push the tension system from the cylinder onto the base of the penis. To ensure correct application, please complete this step in one smooth motion, being careful to pull your scrotal tissue downward before transferring the tension system. Step 6. Removing the cylinder. To remove the cylinder, press the round black pressure release button. Once the pressure is released, remove the cylinder from the penis. Once you have removed the cylinder, you are now ready to begin sexual intercourse. Step 7. Terminate the erection. Grasp the tabs and pull evenly on both sides. Allow 10 seconds for blood to flow from the penis. Once the penis has become more flaccid, pull the tension system away from the body and off of the penis.
All right, so back to our talk. So the best candidates for a vacuum erection device. So any man that is suffering any form of erectile dysfunction is a great candidate for a vacuum erection device. It can be used in conjunction with other therapies. And I always tell patients, look, it's very minimally invasive. Actual cost savings are significant when you actually sum up the amount of money that people spend on injections or pills, and it works. But it's for some people, other people also find it very cumbersome. So I think that it's important just to kind of acknowledge that there are some drawbacks to it. But for the most part, very effective, very safe, and for most men, it does work really well. Now, full disclosure, there are some body habitus, meaning there's some patients that have some anatomy which may make this challenging. So again, contact MedMD if you're having any issues with that. So can this be used in any patients that have partial erections with oral medications or injection therapy? Absolutely. If you just want to step it up a notch and you want to take those therapies to another level, use a vacuum erection device along with that. So again, just like everything, there's no free lunch. There are some side effects. And so the biggest side effect that I feel like is going to be an ineffective erection. So that just means that you have to practice. So once you practice, you can then achieve a good erection. You can also have a blocked ejaculation. That may be just from that constricting band that you're using. You can have some penile numbness. You can have some bruising or discomfort, much like everything else. And so again, go on to medmd.com. There's great resources that kind of treat you or teach you how to mitigate those side effects. Lastly, if you are taking any blood thinners like warfarin, aspirin, Plavix, Lovenox, anything that thins your blood, gotta let your doctor know, because this may not be an appropriate treatment for you. It's going to cause way too much bruising, and it's just not going to be a good situation. So again, if any of those things come to mind that you're taking those, contact your doctor first before using the vacuum device. So without further ado, I'm going to turn it over to Austin, who can now lead the question and answer session, and I'd be happy to kind of answer any questions that people have.
All right, first question here. If using injection therapy in addition to a vacuum device, how long should you wait after the injection until the vacuum is applied?
That's a great question, because I think it takes about 5 to 10 minutes before injections even start to work. So it's kind of hard to tell, should you start using the vacuum device initially? I don't think so. I think you should probably wait about 10 minutes to see what happens with your erection. I think the last thing that you want to do is to kind of mask what the injection is doing by using the vacuum device a little bit too early.
All right, got an interesting question here. How can I prevent my testicle from being pulled into the tube when using the VED?
Yeah, that's a really good question, and that's one of the biggest things that is part of that learning curve. And so I think that when you're pressing the actual button, you're using one hand. With the other hand, the offhand, you need to be pulling down on your testicles and your scrotum. Now, every man's scrotum is different than their neighbor's. And so there are some guys that have really, really small scrotums, and it's kind of stuck to the undersurface of the penile shaft. And those patients, that's a little bit difficult. And so I would contact MedMD just to see whether they have any personalized advice for that. Guys that have very large, generous scrotums, it's a little bit easier to avoid that issue.
All right, got another question here around seals. I'm having trouble getting a good seal. How can I get a better seal with the VED?
I think that you're probably not using those comfort rings appropriately. Remember to use plenty of lube. You may think that it's counterintuitive, but the lubrication actually is a water-based lubricant, so it creates a nice tight seal. And so that would allow for a little bit better adhesion, but it's also, you may just need a smaller comfort ring.
All right, next question here. Can a VED eventually work as good as injection therapy, which I really don't like?
So the two issues with a vacuum device and injections is that they're non-spontaneous. But if you don't mind, the whole process of getting an erection ready, I think with practice, you can certainly achieve an erection that is nearly as good as an injection, but it's not going to happen overnight. You got to practice it. So can you? Yes. Does it take some practice? Absolutely.
All right, I got a few questions here now around Peyronie's disease in VED use.
Yeah.
The first question here, does having Peyronie's disease impact my ability to use a VED?
No, but what's going to happen is that whenever you bring blood into the penis, it's certainly going to accentuate that curve. The reason why someone's penis is curved during Peyronie's disease is that there's now a disparity between different sides of your shaft in terms of length because there's now a scar. And so it's unlikely to make your Peyronies worse, but you are definitely going to have a curve. Now, the limiting factor is that the cylinder itself may prevent the complete deflection of your penis upwards, but as soon as you take off that vacuum device, the penis is going to bend back up like how it wants to.
All right, this next question around Peyronie's disease is kind of a two-parter, so stick with me here. I'm looking to buy a VED for PD. What VED qualities should I look for when purchasing, and are there other devices I should consider?
So is there another part of that question or no?
That was it.
Okay, so good question. There's lots of vacuum devices on the market. I say that you should go for something that is well made, it's very reliable, has good reviews, and has good customer support. Because you can certainly buy some vacuum devices off of Amazon, but if you are accepting it and then you just are sent this whole thing and it just doesn't work, well, there's no one to talk to. So, that's why we do recommend going with a vacuum device with an outfit like MenMD, because they can at least have backup support and they can always be there to help you through and coach you through this process because of that learning curve.
Absolutely. Next question here. What is the difference between a manual pump and an electric pump? Is one an advantage over the other?
There's no advantage either. I'd say that a battery operated pump is more sophisticated, it's fancier, but it's still the same thing. It's based on the same principle. You're going to create a suction to bring blood into your penis. So you can either do it with batteries or use your hand. Look, I mean, I think that I've had patients that use both. They're happy with both. So it's up to your cost point. The advantage of a non-battery is if you don't have to run out of batteries, you don't have to go find them. So, but either one is fine.
All right. Next question here is VEDs and implants. Can I use a VED after I get an implant?
Yeah, I mean, obviously you shouldn't use an implant or you shouldn't use a vacuum device in the first few months after you just had surgery. But long term, I think you certainly can. That's not an issue. And so the question really is there any tissue left within my penis to bring blood into if there's an implant in place? Yes. So if your implant is done by someone that knows what they're doing, there should still be spongy tissue that's left behind that will accept blood flow.
All right. Does the pump make you have to urinate during or after using it?
I haven't heard of that before, but so I can't speak to that directly. So I don't know. I don't think so.
I didn't know either. That's why I included it.
Yeah.
First time hearing it.
Yeah.
Next question here. How many times should I practice with the VED before attempting with intercourse?
So you should be comfortable, you should be confident, and you should be happy with the result before taking it onto the big stage. So much like anything, I think that I tell all my guys that use vacuum devices, injections, or they have an implant, they should be happy and confident before they pursue intercourse. Because if it's a bad experience the first time around, it's going to discourage you and your partner. So once you feel like, yeah, I got this, my erection's good, let's use this, that's when it's time to use it.
All right. Next question here. What benefit, if any, can one expect by starting a rehabilitation routine using a VED and injection therapy 6 years after prostate removal?
So 6 years after prostate removal, and you're not having any natural erections or spontaneous erections. So number one, you're unlikely to ever have those spontaneous erections return. It typically takes maybe at most 3 years for erectile function to return. After 6 years, I think your destiny is to either needed injections or a vacuum device or an implant or pills or whatever. It never hurts to use a vacuum device at any point, no matter how far you are out from having your prostate removed, because your penis has been starved of blood flow. Let's bring that blood flow back in. And so there is no line in the sand. I think that it's always important that you use it, no matter no matter how far you are out from that prostatectomy.
All right. When I used my device, it created so much suction that it tore the skin under the head of my penis. What did I do wrong?
I think that probably instead of just waiting for that, 1 or 2 minutes in between those pumps, I think that you're just kind of going gung-ho and you're just bringing in too much suction and all in one go. So it's all about just kind of going gently increasing the size of your penis in a staged manner, not just going for glory.
All right. Why does my erection not last? As soon as I release the vacuum, the erection falls flat.
Well, I guess, are you using a ring or not? If you're not using a ring, that's probably the biggest culprit. If you are using a ring, maybe that ring isn't tight enough, because it should last a reasonable amount of time with a ring, and it shouldn't just go completely flaccid. But if there is no ring, then that would be the simplest explanation for that.
All right, got a couple diabetic questions coming up here. First one, I'm a diabetic. Can a VED help me get an erection?
Yes. So we have patients that have spinal cord injuries. They've got bad diabetes, mild diabetes, and a vacuum erection device is just all it is. It's a vacuum that has no brain. It's going to bring blood flow into your penis. So if you can use it properly, and again, there's a learning curve and there's resources, it should give you an erection. Now, is the erection spontaneous? No, you need to use a vacuum device. Is it going to return your erections naturally if you leave your diabetes unchecked? Absolutely not. Your diabetes is what's causing the erectile dysfunction, and you get a better handle of that with diet, lifestyle modification, exercise.
All right, next diabetes question. Does type 2 diabetes medications, he gives a couple examples here, I'm going to butcher them, metformin, glycyrrhide, do they affect using a VED?
No, they're not blood thinners, so there's no issue with using a VED while taking those medications.
All right. I've used a VED subsequent to a prostatectomy in 2007. I had pain from wearing the ring then. Have there been any improvements to the ring to prevent this? Any tips if not?
Well, I think you should probably reach out to MenMD regarding, do they have any different rings, and to kind of describe your experience, what's going on. I also think that, there's a huge market for constrictive bands, even independent of a vacuum device. And I think that there is some utility if the one that's supplied by the one from your compounding pharmacy didn't work for you. Maybe just going to a sex shop and talking to some experts there, they actually may be able to give you some really good advice on that.
Yeah, absolutely. And I think most of our VEDs that we sell come with rings, but we also sell an adjustable ring. So if one of the rings that comes with the system doesn't work, you can certainly go that option. So, all right, next question here. How can I deal with venous leaks?
So venous leaks just means, you've just had some bad luck. So venous leak can be caused by a lot of things. Peyronies, trauma can be caused by just random bad luck with your veins. And so venous leak erectile dysfunction is just one way of classifying erectile dysfunction, and that's diagnosed with an ultrasound. How you treat that, though, is still, you're going to be going through the same toolbox that is prescribed by our national guidelines and by us urologists or even primary care doctors. You go through the list. And again, it's the same list that's available. So vacuum device, pills, shots, implant, all of them are acceptable. It just depends on what your individual goals are. And currently there's no good vascular surgery to undo the issue of venous leak at this time.
All right, next question here. Does the VED actually help regain length? What is the best exercise routine to regain length?
So I think we reviewed that earlier in our penile rehabilitation regimen. Again, it's just doing it for at least 15 minutes per day, really just trying to push the limits in terms of how much stretch you can get. Can it make you longer than you ever were? No. I mean, maybe just like a very infinitesimal amount. Can it try and bring you back to what you were? That's the goal. And I think that your penis at some point had a potential for some growth. The goal is to give the tissue back some health, give it back some stretch so you can try and get back to that point.
All right, next question here. I've been using the VED for about 1 month with no good results. Also doing injections up to 60 units with no good results. Am I doing something wrong?
Yes, it's possible, or you just may need some education, whether it be injections or the vacuum device. I think with the injection or the vacuum device, I think it's important to kind of contact either your referring urologist or a MD, just to kind of get a sense of, you know, what's going on. Don't feel like you're alone in this. Contact somebody.
All right. Could I regain my ability to get an erection naturally by using a VED?
So if you use a VED along with, so it really just depends on what was the source of your erectile dysfunction. So let's just say someone did not have treatment for cancer. They had worsening erectile function because, let's just say they just didn't control their cholesterol, had bad diabetes, or their blood pressure went through the roof. Well, if you use a vacuum device along with modifying your lifestyle, really eating healthy, exercising with moderate levels of cardiovascular exercise, and losing weight, yes, then the sum of all those parts can restore natural function.
All right. What is the best method to move the constriction ring onto the penis and remove the VED? I'm having trouble with this step.
So, you know, as the video kind of implied, you really just gotta bring the ring down as you're releasing the actual vacuum seal. So it's kind of like a one, it's a single motion. It takes practice, but I would then just contact MD to see if they have any individual advice for that.
All right. If injections haven't worked, can a VED work?
So if injections haven't worked, a VED will likely work just because the VED is very good at bringing in blood flow. Now, will the erection maintain itself? That's the bigger question. And so that's where it comes to really being able to use a constriction band properly, bringing enough blood and practicing. So if the injection isn't working, the VED may work because we're not really relying on those arteries or anything like that. Even though those arteries are shot, we're still trying to bring in blood. So there still may be some use in that.
All right. Got a question here about after reconditioning. When I use the pump, I go through my reconditioning set, and when I'm done, my foreskin is bloated and distorted. It goes back to normal, but is this to be expected? Am I doing something wrong?
Yeah, it's to be expected. Unfortunately, you know, foreskin does a really good job of holding onto fluid. It's very good at getting what we call edema, which is just kind of our normal fluid that we have, and it just gets stuck behind there. And once the penis becomes a little bit more flaccid, then the foreskin is allowed to drain. So it's just an expectation.
All right, I got another question here around the tension rings, constriction rings. How tight is too tight for a tension ring? What is the best type to use?
So I think that if it hurts you, it's too tight. If it doesn't, and I think that's probably your biggest indicator is you. If you're seeing that it's harming your skin and that it's kind of causing, you know, erosions and bleeding and scabbing, then you're just using it too tight. So, you know, there's some trial associated with this in terms of just using this repeatedly. And so if you are kind of encountering that during your initial things, you're just using it too tight of a tension ring.
All right. Does the application of the constriction ring after using VED cause damage to the penis over time?
If you leave the constriction ring on for too long, it can definitely cause actual damage to the superficial skin. Now, you know, I've had guys leave on constriction rings for hours. Yeah, that can cause some serious damage to your penis as well. So use some common sense. Don't use a constriction band for more than 20 or 30 minutes.
All right. I have a problem having an orgasm when using the constriction ring. Do you have any suggestions?
So I guess, it really would be a question of, are you just not seeing your ejaculation, or you're just not being able to experience the sensation of orgasm? So if it's just like, oh, I'm not able to see my ejaculation, well, the constriction band's actually, it's placed in a way that it's distal to where your fluid's being released, so it's just stopping the fluid from coming out. If it's orgasm, the orgasm itself is controlled by separately different nerves. If you're not super confident in your own sexual, in your own performance, that can be one of the issues where people are not experiencing a very good orgasm. So there's lots of explanations for that. That's a complex question.
All right, next question. Is a VED a long-term solution for ED?
It's a long-term solution. Yeah, absolutely. If you're using it properly and you are happy with the results, it's a long-term solution. Absolutely.
All right. I heard I need to manscape to get the best seal. Is that true?
It certainly doesn't hurt. So if you're having some issues with adhesion and you're just got a big old bush going, maybe you should probably trim.
Is it true that if you don't use it, you will lose it?
Yes. So if we're talking about a vacuum device, no. But if you don't use your penis and you're not having those nighttime erections, well, yeah. What's going to happen is slowly, every day that goes by, your tissue is becoming more stiff, more scarred, more fibrotic. You're replacing that spongy, nice, elastic, healthy tissue with scar. So you're losing your ability to have a nice, straight erection the more you don't use your penis.
All right. Is it possible and or sensible to use a VED in combination with Viagra or sildenafil?
Absolutely. Yep.
All right. Is it safe to use a VED in the shower?
If you're able to maintain a good suction on there, sure. Just don't use the battery operated one. Use the manual one. Definitely don't use a battery operated one in the shower.
Yeah, that's good advice right there.
Yeah.
All right. Next question. Prior to implant surgery, when should one stop using the pump device?
There's no reason to stop until the day of surgery, as far as I'm concerned.
Okay. Do you need to be partially aroused to initiate successful use of the VED?
No, you can be completely flaccid for it to be effective.
All right. Got another question kind of similar to that. They want to know if the VED can provoke an erection without stimuli. So I guess maybe visual stimuli.
Can it provoke an erection with visual stimuli? I mean, you can certainly, it doesn't hurt. Any partial erection would probably be easier to place it, but still, we've got lots of guys that have nothing, no activity down below, and they can use a vacuum device with no issue.
All right, another question here. How long after prostate surgery should you start using a VED?
So we recommend starting to use it right after the catheter comes out. So 7 days after surgery typically, or 10 days, just depending on what your surgeon's preference is. Use some PDE5 inhibitors as well as a vacuum device. If you want to be, really gung-ho about doing this, no issue with really, it's not going to disrupt the surgery.
All right, got another Peyronie's disease question here. Do you think RestoreX traction device and a VED are a good solution to early diagnosed PD?
Absolutely. Yeah, I think that RestoreX is very good in terms of Peyronie's disease treatment.
Yeah, absolutely. And we actually did a Peyronie's disease webinar a while back, so you can check that on MinMD's webinar page as well. Back to the VEDs though. Many pumps that are advertised are quite expensive. What reasonably priced pumps would you recommend?
Well, I think that the pumps from MinMD are actually pretty reasonable compared to competition, and it comes with very good customer support. I think that there's a balance. I mean, if you're looking for like a really cheap VED, you're going to get a really cheap device. So there's a balance. I don't really believe in people spending thousands of dollars on these things. I think that, a reasonable amount would be up to $200 or $300 for a quality product that has good customer support, that's what I'd recommend.
Absolutely, and our cheapest VED starts at $119 with free shipping. All right, next question here. Even heavily lubricated, my uncircumcised penis sticks to the side wall. Any suggestions?
You know, I could say use more lubrication, but I don't have any suggestions. I mean, being uncircumcised, that can introduce some minor challenges with a vacuum device for some people. You just kind of got to deal with it.
All right, get another question around orgasms here. I'm able to experience all of the sensations of an orgasm, but I'm not able to ejaculate. Is that because I have damage to the seminal ducts?
So it really just kind of depends on what your history is. If you had any sort of prostate surgery, that can be the most obvious answer. Also, if you're taking any medication for an enlarged prostate, that can also cause that. Or if you're using a constriction band, well, the constriction band is stopping the ejaculate from coming out.
All right. Get a question from, seems like a newbie here. Is the erection produced by the vacuum device painful or not?
It should not be painful. So if it is painful, you're not doing it correctly.
All right. Got another question here that is, it's actually not about VEDs, so we'll transition away from that a little bit. What are your thoughts on sound wave therapy for ED?
I would say that our official statement from our national guidelines is that it should only be used in a clinical trial setting. I'll leave that to everyone's own interpretation. I personally don't do any shockwave therapy. I have some patients that swear by it. I also have some other patients that feel like it didn't work. So to each his own. It's quite expensive. So talk to someone that actually has experience with it, and I would definitely suggesting a urologist that does it. Don't go see a non-urologist that does this, because that is definitely not their expertise.
All right. Why is it that more often I take sildenafil, the softer my erections get? Will I eventually not be able to use sildenafil?
So, you know, as time goes by, depending on what caused your erectile dysfunction, what's happening is that, you know, your own natural function is declaring itself oftentimes. And so people feel like, oh, I'm becoming a little bit, you know, my body's getting used to Viagra. No, actually, I think that what's happening is that your own natural body's way of kind of worsening erectile function is kind of manifesting. So that could be an indicator that maybe you're still not taking good care of yourself, you're in poor health, or maybe your body is just telling us that, yeah, you got bad luck. You know, I think definitely talk to your urologist about that.
All right. If injections haven't worked, how likely is it that a VED will work for me?
Yeah, I mean, I think that to each his own. I think that there's some people that, you know, an injection doesn't work, but a vacuum device can certainly work as long as you practice.
All right. Got a question here about Sudafed. Is using Sudafed to reduce erections after sex appropriate? Erection does not subside within 30 to 45 minutes after injection. Should I wait longer?
I mean, it can take a little bit longer to subside. You know, you can always kind of go down on the amount of medication you inject yourself with, just to see whether that kind of changes that, whether you can still have a good erection, but maybe then the erection doesn't last as long or doesn't last longer than you want. Another strategy which I tell patients is, in addition to Sudafed, apply ice. Also do something that's strenuous cardiovascularly. If you got stairs, that's my go-to. I have patients run up and down the stairs, get their heart rate up, and the natural adrenaline that your body releases can also kind of decrease your erection as well.
All right. Is VED viable for someone who has suffered with ED for 10 or more years?
Yes.
Let's see. I lost about 1 inch from surgery. Will the VED help recover lost length or help you gain more than you had prior?
So, you know, it will never allow you to gain more than prior. The goal is to get you back to what you were. It's going to take practice, discipline. I have guys that use Restorex along with a VED as well. But it's all about how motivated you are. Also, I would be mindful about whether you've gained weight. A lot of people after prostate surgery tend to gain weight in their infrapubic and they're kind of in their the area just above the base of their penis, and that kind of shrouds over your penis. That can also give the perception of some penile length loss. But I mean, the biggest issue after the prostate's taken out, or your bladder and prostate, is that there's less blood in your penis, and the penis is shrinking up on you. So you want to get the blood back in to kind of unshrink your penis. That's the biggest thing.
All right. After a shunt due to a lengthy priapism and a flaccid issue in half the penis, will a VED help me?
Yeah, I think that a VED is super important in patients that have been treated for priapism. You definitely have a little bit more scarring and fibrosis, and it's all about bringing blood supply back in, bringing good, healthy blood flow into the penis, kind of dissolve some of that scar tissue. There's no promises, it's kind of just an unfortunate situation, but it's certainly very helpful to do a vacuum device.
All right, next question here. I've had a prostatectomy in August 2018, and I'm taking testosterone shots, but still having erection issues. I have a different style vacuum tube. So I'm guessing they want to know if there's a certain tube that would help better.
I think that probably, what was the question? It was that they had their prostate taken out and they're using a vacuum device and it's just not working that great?
Yeah, and they're taking testosterone shots as well.
I think that it's kind of independent of each other. Continue with your testosterone as long as it's allowed by your urologist. And perhaps, I'd review with whomever you got your vacuum device what you're doing and whether it's being used effectively. Usually it's user error is the biggest culprit for vacuum devices not working.
Okay, got a question about post-prostatectomy. What percentage of your patients suffering from ED after radical prostatectomy recovered after using a VED and or trimix?
So VED is very good for penile rehab. It's probably not really vastly improving anyone's erectile function outcomes. Erectile function outcomes are really dictated by, number one, did you have a nerve sparing procedure? Was it one or both sides? Number two, what was your function like before the prostate was taken out? If you had great function before the prostate was taken out, the odds are in your favor to have good function afterwards, as long as nerves were spared. Now, if you were having some issues with erections even before the prostate was taken out, well, now you're kind of playing from behind. And so can people do well with a VED? Yeah, those are people that tend to be very good even before the prostate was taken out. Injections, I think that people are going to recover depending on, number one, their own bodies, as well as some luck, and the quality of the nerve sparing procedure they're done, and time. So those are really the biggest factors in terms of allowing someone to return, to have return of function.
All right, got an insurance question here. Does Medicare cover any of the costs for VEDs?
I think, Austin, do you know that question? Do you know that answer?
I don't think that they do.
Yeah, I think they used to, but I don't think so anymore.
Right. All right, next question here. Can you discuss the lubricants used with the VED? What are the options?
Should be a water-based lubricant like a KY or just anything that's just water-based.
Let's see. Can you use a VED before injections?
Directly before, certainly. I don't know if I would really recommend. I think that you're just doing a little bit too much if you're injecting yourself before, or you're doing a VED before you inject yourself. I don't know, Austin, have you had any thoughts or patients kind of do that?
I've heard from prior webinars, one of the doctors said that it was okay to pump in order to make the target location bigger.
Yeah.
When you inject. That's the only time I've heard someone suggest that method.
Yeah, I think probably not to really achieve a super firm erection, probably just to kind of help with aim.
Yep, I see he's got actually a follow-up question. Can you use the VED to help find the correct spot for injection? So that would be, it seems like that might be the only time you would use it.
Yeah, you've got a little bit of a hidden penis. I think that's super helpful.
Yep. All right, next question. How much vacuum pressure is too much, and are injections causing scarring? So that's a two-parter right there.
So if it hurts if it hurts, then I think there's too much suction. Injections, I've got hundreds and hundreds of patients that inject themselves, and I really haven't seen any significant scarring that's going to be significant. Now, patients can also develop Peyronies too, but that tends to be an independent issue. So people can kind of get tricked with the fact that, yeah, they're having some scarring, but is this caused by Peyronies or injections? I think that Peyronies is kind of happening independently.
Yep. All right, next question here. Some rings to achieve erections are designed to go around the penis and the testicles. Are they usable with the VED?
I wouldn't use it. I wouldn't use those rings around the testicles. I think you should just use the ones for the penile shaft.
Right. Let's see. Oh, this is an interesting question right here. I've fallen asleep with the pump on and was still erect hours later after. How bad is that?
It's not, I mean, just like, having an erection lasting longer than 4 hours, it's not terrible. Just don't do it again.
Yep, once is enough. All right, I got an implant question here, something a little bit different. If you don't have 100% ED problem, but would like a penile implant, could that be approved easily? I'm not sure who's approving that.
The penile implants are approved by Medicare, but a lot of insurance does cover penile implants, but you have to go through the motions. Someone has to demonstrate that they've been non-responsive to more conservative treatment options like injections or pills and whatnot. So it just really depends on your own particular insurance.
Okay. Got another interesting question, not about VEDs necessarily, but it is interesting nonetheless. My urologist spoke to me about Botox injections, which should last about 6 months. Any thoughts?
So my wife's a plastic surgeon, and I have never heard of Botox in the penis. So I would not do that.
Like I said, interesting question right there.
Yeah.
All right. Addition to question about orgasm, I know there will be no ejaculation, but I had nerve-sparing surgery, but during sex or masturbation for a long period of time, I do not have an orgasm. Is there anything that can help me?
Well, I think that orgasm is controlled by separate nerves. I know that you acknowledge that you're not going to ejaculate, but I think that's where you should definitely talk to your sexual health professional about some issues. A lot of people are experiencing some issues with achieving orgasm just because they just don't feel as sexual after their prostate's taken out. And if you just don't feel as sexual, or maybe your testosterone's low, or you're just not feeling really super, great about yourself, an orgasm can be challenging.
All right. This is the last question here, everybody. Believe it or not, we got through all of the questions. It's got to be a record of some sort, but here it is. For individuals that are uncircumcised, should the foreskin be pulled back first before using the VED?
That's a good question. I think that naturally, when you have an erection, the penile skin gets pulled back. I think it's certainly helpful to pull back the skin because when it becomes erect, that's what's going to happen.
All right. Okay, with that, we'll go ahead and wrap this up. So I would like to thank Dr. LohDoyle for taking the time to present today. And we'd also like to thank everyone listening in for attending this Minimum Real Talk webinar, as well as submitting all of your questions today. We hope it was informative, and you'll join us again in the future. If you'd like to learn more about VEDs, you have a few options here. There are more resources in the Resource Center on minimd.com. Visit this page to view instructional videos, guides, expert articles, and much, much more. And we're actually going to be having some articles written by Dr. LohDoyle himself, so keep an eye out for those as well. If you have questions and would like to speak with someone in person, you can call MinMD at 857-233-5837 or log into the password-protected secure MinMD portal to schedule an appointment with a MinMD clinical case manager. If you don't have a specialist for your sexual or urinary tract health, MinMD has a new physician finder service. Go to minimd.com and click Find a Physician in the top right corner to get started. And finally, if you're interested in purchasing a VED from us, You can do so on the shop page in the UNMD portal or by calling into our office at 857-233-5837. With that, I'd like to thank everyone again for attending today's webinar, and we'll see you at the next one.